and welcome to the fourth and last episode of COVID Shorts, a Foster Feed series of 4 episodes concerning the second wave of COVID-19 pandemic in India. In today's episode, we will be learning about the remaining miscellaneous topics that we need to know about the COVID-19 infection from our very respected Professor Dr. Abhishek Ghosh sir.
Welcome back, sir. Sir, what is the importance of diet in preventing COVID-19 infection?
Yes, actually, healthy diet is of course needed in every critical illness, including this COVID, and just follow the basic principle that avoid very oily food and of course balanced nutrition is needed. You have to take carbohydrate, proteins as well as fat in moderate amount, and don't avoid proteins. Actually, this time to combat the acute situation, we need protein. So better to supplement with any kinds of proteins you like, fish or chicken or egg that can be supplemented along with daily fruits, citrus food intake that will help you to maintain your nutrition as well as adequate vitamin C balance is needed during this. And no, of course, vitamin D supplementation is also needed, and you can take some fruits which are rich with vitamin D or calcium. So actually, balanced diet is needed. No, and you have to take adequate water because often dehydration is a very common thing in during these hot summer episodes. And if you down with dehydration, then you will take much time to recover from this COVID infection. So nothing to special mention that this food prevents COVID or this food actually aggravates these symptoms. This is not nothing like that. But balanced food, that is all we need.
So these days, so many food supplements are in the market and they all claim to increase our immunity, boost our immunity. So how effective are these supplements?
Yes, actually, immunity does not build within days. If you are neglecting your body for long years and just during this COVID pandemic, you are trying to boost your immunity by taking vitamin supplements, that will not, I think, increase your immunity much. If you have maintained your lifestyle well long ago before this pandemic, then your immunity will respond better. And immunity boosting is multiple medicines are now believed to tell that they are increasing immunity. But actually, if you supplement well with a commonly used vitamin like vitamin A, C, D, E, and few of course there is some role of zinc. So these are the agents, not very rarely used minerals. They are also increasing immunity, but that will not increase that will help you in during acute situation. That will actually help you to recover well little bit faster than the other common peoples. But use the commonly used vegetables and fruits, and normal eating. From normal eating we can get the normal immunity, not boost your do not overload with your food supplements to increase your immunity. If you have lifestyle is good, then keep confidence on that and eat whatever you eat, try to eat fresh fruits, vegetables, and whatever for animal source proteins, you have to eat it fresh. Don't use refrigerated food for longer time, and at least to try to take fruits daily and try to take any kinds of protein supplements. Protein supplements means egg, chicken, or fish, anything you like. Or if you are a vegetarian, try to increase the protein intake by taking regular pulses, milk, and maybe you take soybeans like that. But ensure you have got enough protein supplements and adequate fruits.
And what is the diet a corona patient should follow?
That proper nutrition and hydration are vital. People who eat a balanced diet tend to be healthier with stronger immune systems, and so you should take a variety of fresh and unprocessed food every day to get the vitamins, minerals, dietary fruits, fiber, proteins, and antioxidants. And drink adequate enough water and avoid excess sugar, because often some drugs because sometimes we need to use steroids during these acute situations, so that may increase your blood sugar. So avoid unnecessary sugar, avoid extra fats and salts also, because often there is a, because sometimes COVID patients are suffering from heart failure also. COVID myocarditis is there, so there is chance of salt and water retention during that time. So we know that excess salt is harmful, excess sugar is harmful. So yeah, try to maintain that during this situation also. Nothing extra we need, but also we have to follow the basic principles. Okay, and take regular foods in regular intervals, and 4 to 6 hour interval, and try to take it fresh. And processed food should be avoided.
Okay, sir. Sir, is it safe for pregnant and lactating women to take the vaccine?
Actually, when trials were done during this to make this vaccine, pregnant and lactating mother were excluded from the study population. So we do not have enough data on how the vaccine will work in the mother, and how what is the impact on the baby. So better to avoid this in pregnancy, as the trial is not sufficient to prove their utility. But if in lactation, I think it is not secreted through the breast milk significantly, and we can use it during lactation. But if, as data, once again, data is insufficient, the idea is now that if the mother is a care worker or frontline worker who are daily contacting some COVID patients, or have possibility of contacting the COVID patients, they should take the vaccine early. And if the mother is not frontline worker, can stay at home, or uh, maybe avoiding the impossible if he avoid, if she can avoid the COVID patients or contact, then she can wait before during this, and as soon as the lactation period is over, she can take this. But for the care worker, it is important that after delivery she can take the vaccine if possible, if available.
And so, what are the myths about corona that need to be busted?
Mm. So myths about corona are there. Uh, every day such myths are overflowing in the WhatsApp and Facebook. So corona is not a man-born disease. Uh, I think that is the myth. So corona is definitely a virus which has mutated to some dangerous form, and that's why there is high transmission uh, transmission rate, high infectious rate, and as the second myth is that corona do not leave it in warm weather, but as you find that this second wave that is starting in the summer and it is increasing. So I think in cold and as well as hot weather, COVID corona uh, the SARS coronavirus is active equally. So nothing like that. If it is warmth, we are safe. Third myth.
And recently, we saw that women on periods cannot take the vaccine.
No,
Posts like
no.
this overflowing in the social media. So that is also a myth, I guess.
Yes, yes, yes. Can drinking alcohol prevent for corona? That is so this was actually, as we are using hand sanitizer, alcohol based hand sanitizer previously, there was a myth that drinking alcohol also prevent corona, but drinking alcohol such as beer
Eventually.
doesn't help prevent coronavirus. You should wash your hands often, and wear mask, and avoid being close to those with a fever and cough. That's what we need. Drinking alcohol within alcohol inside the body is not a good thing to do this during this corona. Um, and second myth is that and some myth, second myth, there is another myth is that, can UV bulbs used for the disinfecting be used to kill COVID on our body? So some UV bulbs were present in the often patients persons keep there in the room, but don't use UV light bulbs on your hands on any part of the body, because that can damage your skin, and often can lead to unnecessary use, can lead to skin cancer also, aggravate your skin cancer. Okay. And another myth, some patients ask that I have taken influenza vaccine, I have taken pneumonia vaccine, should I take the COVID vaccine again? Because this influenza vaccine is also a vaccine against virus infection. So is there any benefit? But yes, you have to take it again, because the virus is separate and antigen antibody developed is also separate. So antibody developed after influenza vaccination is not going to protect you against the COVID. So you have to take it. There is a common question about how to protect our child, because child are not getting, actually it's not child, also adolescent, but adolescent below 18 years, they are not getting vaccine. And even for the child also, actually ivermectin is not also advised. So how to protect your child? So normal child's actually there is no way. We should not use ivermectin. Also doxycycline is also contraindicated in children. Vaccination is also not possible. So try to give your child some nutritional support which will boost their immunity. So give them regular fruits, give them regular fishes, egg, chicken, etc., so that their protein supplements and supplementation and vitamins are adequate. And you can only give some additional supplement of vitamin C, D, zinc. Some syrup is there, like Bifon, Fortsby, etc. is there, which have contains all these agents. So right, select that supplement adequate by consulting your pediatrician or the regular physician, so that this their immunity is only the hope, or which we can increase by. Otherwise, there is no option in the child so far.
Thank you so much, sir. I'm extremely grateful for your time and the effort you put in the making of this series. Hope to have you on our channel sometime soon. Thank you very much.
I hope you found today's episode helpful. If you did, please share as much as you can so that people get aware and notified about the actual facts about the COVID-19 pandemic. If you like the videos I create, make sure to subscribe to Foster Feed and hit the notification bell so that you get notified every time I upload a new video. See you soon in my next video. Until then, take care.